Every 40 seconds, someone in the world has a stroke, and you have less than 3 hours to save their brain. Right now, someone you love could be having a stroke and not even realize it. The signs are subtle but deadly. What you're about to learn could save a life today. These warning signs are often ignored until it's too late. A stroke happens when blood flow to your brain suddenly stops. Brain cells start dying within minutes. There are 2 types of strokes. Ischemic strokes block blood vessels. Hemorrhagic strokes cause bleeding in the brain. 85% of all strokes are ischemic. A blood clot travels to your brain and cuts off oxygen supply. Without oxygen, 2 million brain cells die every single minute. Time is literally brain tissue disappearing. The faster you recognize stroke symptoms, the better the chances of full recovery. Every second counts. Most people wait over 24 hours before seeking help. This delay causes permanent brain damage. Here's the terrifying truth. Strokes can happen to anyone at any age, even young healthy people. The number 1 tool to recognize a stroke is the FAST test. Learn these 4 letters right now. F stands for face. Ask the person to smile. Does one side of their face droop down? If one side of the face sags or feels numb, this is a major red flag for stroke. A stands for arms. Ask them to raise both arms. Does one arm drift downward involuntarily? Weakness or numbness in one arm is a classic stroke symptom. Don't ignore this sign. S stands for speech. Ask them to repeat a simple sentence. Is their speech slurred or strange? Difficulty speaking or understanding words means the brain's language center is affected. Act immediately. T stands for time. If you see any of these signs, call 911 right now. Note the exact time. Don't wait to see if symptoms improve. Don't drive to the hospital yourself. Call emergency services immediately. Tell the 911 operator you suspect a stroke. Ambulances can alert the hospital to prepare the stroke team. Now let's talk about other stroke symptoms people often miss or dismiss as something minor. Sudden numbness or weakness on one side of your body is a critical warning sign. This numbness can affect your face, arm, leg, or entire side. It comes on suddenly without warning. Sudden confusion or trouble, understanding what people are saying indicates brain dysfunction. You might feel like you're in a fog, unable to process simple information or follow conversations. Sudden trouble seeing in one or both eyes is a stroke symptom many people don't recognize. Your vision might go dark in one eye, blur completely, or you might see double. Sudden trouble walking or loss of balance happens when stroke affects your brain's coordination center. You might feel dizzy, stumble, or feel like the room is spinning around you uncontrollably. A sudden severe headache with no known cause can signal a hemorrhagic stroke in progress. This isn't a regular headache. People describe it as the worst headache of their entire life. If you experience a thunderclap headache that peaks within seconds, call 911 immediately. Some people experience nausea and vomiting along with stroke symptoms. Don't dismiss these signs. Now here's something crucial: mini strokes or TIAs. These are warning signs of a major stroke coming. A TIA causes the same symptoms as a stroke, but they disappear within minutes or hours. Many people ignore TIAs because the symptoms go away. This is a huge mistake that costs lives. 1 in 3 people who have a TIA will have a major stroke within a year. If you've had temporary stroke symptoms that resolved, see a doctor immediately. Don't wait. A TIA is your brain's final warning. It's giving you a chance to prevent permanent damage. Let's talk about who's at highest risk for stroke. Knowledge is your best protection. High blood pressure is the number 1 risk factor. It damages blood vessels over time. If your blood pressure is consistently above 140/90, you're in the danger zone. Diabetes increases stroke risk by 2 to 4 times. High blood sugar damages your arteries. High cholesterol builds up plaque in your arteries, creating blockages that can trigger strokes. Being overweight or obese puts extra strain on your cardiovascular system and increases risk. Smoking damages blood vessels and makes your blood more likely to clot. Quit now. A sedentary lifestyle weakens your heart and circulatory system. Movement is medicine. Heavy alcohol consumption raises blood pressure and increases stroke risk significantly. Atrial fibrillation causes irregular heartbeats that can form clots. Get your heart rhythm checked. Family history matters. If close relatives had strokes, your risk is higher. Know your history. Age is a factor. Stroke risk doubles every decade after age 55, but young people get strokes too. Stroke rates in people under 45 are rising dramatically. Don't think you're too young. Women face unique risks, including pregnancy complications, birth control pills, and hormone therapy. Migraines with aura are linked to increased stroke risk, especially in women who smoke. Stress and chronic inflammation damage blood vessels over time. Manage your stress levels. Sleep apnea reduces oxygen to your brain during sleep. Treatment reduces your stroke risk. Now let's discuss what happens when you call 911 for a suspected stroke. Emergency responders will check vital signs and perform a stroke assessment in the ambulance. They'll notify the hospital so the stroke team is ready when you arrive. Minutes matter. The hospital will immediately perform a CT scan to determine what type of stroke occurred. For ischemic strokes, doctors have a 3-hour window to give clot-busting medication. This medication, called TPA, can dissolve the clot and restore blood flow to your brain. The earlier TPA is given, the better your chances of complete recovery without disability. For some patients, doctors can perform a thrombectomy to physically remove the clot. A catheter is threaded through blood vessels to the brain to pull out the blockage. Thrombectomy can be effective up to 24 hours after stroke in carefully selected patients. For hemorrhagic strokes, treatment focuses on controlling bleeding and reducing pressure in the brain. Surgery may be needed to repair the burst blood vessel or remove accumulated blood. After the acute phase, stroke patients begin rehabilitation to regain lost functions. Physical therapy helps restore movement, strength, and coordination in affected limbs. Occupational therapy teaches patients how to perform daily activities despite limitations. Speech therapy addresses communication difficulties and swallowing problems after stroke. The brain has remarkable plasticity. New neural pathways can form to compensate for damage. Recovery is a marathon, not a sprint. Progress continues for months and even years. Some stroke survivors make full recoveries. Others face long-term disabilities requiring ongoing support. Prevention is always better than treatment. Let's talk about protecting yourself from stroke. Control your blood pressure through diet, exercise, medication, and stress management. Monitor your blood pressure regularly at home. Know your numbers and keep them healthy. Manage diabetes carefully through blood sugar control, medication, and lifestyle changes. Lower your cholesterol through diet and medication if needed. Get tested regularly. Maintain a healthy weight through balanced nutrition and regular physical activity. Exercise for at least 30 minutes most days. Walking, swimming, cycling all protect your brain. Eat a diet rich in fruits, vegetables, whole grains, and lean proteins. Limit processed foods. Reduce sodium intake to keep blood pressure in check. Most people eat far too much salt. Quit smoking immediately. Your stroke risk starts dropping as soon as you stop. Limit alcohol to moderate amounts. That means no more than 1 drink daily for women, 2 for men. Get treatment for atrial fibrillation. Blood thinners can prevent stroke-causing clots. Take prescribed medications consistently. Blood pressure pills and blood thinners save lives. Get regular checkups with your doctor. Early detection of risk factors prevents strokes. Know your family medical history. Share this information with your healthcare provider. Manage stress through meditation, yoga, deep breathing, or whatever works for you. Get adequate sleep every night. Poor sleep increases inflammation and stroke risk. Treat sleep apnea if diagnosed. CPAP machines ensure your brain gets oxygen all night. Stay socially connected. Isolation and loneliness increase health risks, including stroke. Keep your mind active through learning, reading, puzzles, and mental challenges. Women should discuss stroke risks related to birth control pills with their doctors. Pregnancy increases stroke risk. Report concerning symptoms immediately during and after pregnancy. Migraines with visual auras warrant extra attention to other stroke risk factors. If you've had a TIA, aggressive prevention is critical. Follow all medical advice. Take antiplatelet medications like aspirin if prescribed by your doctor for prevention. Some people need carotid artery surgery to remove dangerous plaque buildup. Stents can be placed to open narrowed arteries and restore proper blood flow. Advanced screening tests can detect problems before they cause strokes. Ask about options. Carotid ultrasound shows whether neck arteries are narrowing. This test is quick and painless. Holter monitors record heart rhythm over 24 hours to detect atrial fibrillation. Echocardiograms show heart structure and function, revealing problems that increase stroke risk. Blood tests check cholesterol, blood sugar, and clotting factors that contribute to risk. MRI scans can reveal silent strokes and other brain changes before symptoms appear. Now let's address some stroke myths that prevent people from getting help quickly. Myth: strokes only happen to elderly people. Fact: strokes occur at all ages, even in children. Myth: stroke symptoms are always obvious and severe. Fact: many strokes start with subtle signs. Myth: if symptoms go away, there's no problem. Fact: TIAs require immediate medical attention. Myth: you can wait until morning to seek help. Fact: every minute of delay destroys brain cells. Myth: stroke isn't preventable. Fact: up to 80% of strokes can be prevented through lifestyle changes. Myth: stroke recovery ends after 6 months. Fact: the brain continues healing for years. Myth: young healthy people don't need to worry about stroke risk. Fact: young stroke rates are rising. Myth: all strokes cause paralysis. Fact: stroke symptoms vary widely depending on brain location affected. Let's talk about recognizing strokes in others, especially when they can't communicate clearly. Look for facial asymmetry when they try to smile. One side drooping is a red flag. Watch how they walk. Sudden coordination problems or veering to one side indicates trouble. Notice if they're suddenly confused or having trouble following simple conversations. Pay attention to sudden personality changes or unusual behavior. This can signal stroke. If someone complains of the worst headache of their life, take it seriously. Watch for sudden vision complaints like, "I can't see," or "everything looks strange." Notice if they suddenly drop objects or can't hold things in one hand. Slurred speech or inability to find words are classic stroke communication problems. Trust your instincts. If something feels wrong, call 911. Better safe than sorry. When you call 911, provide clear information about symptoms and when they started. Note the exact time symptoms began. This determines which treatments are available. Stay with the person. Keep them calm and comfortable until help arrives. Don't give them food, drinks, or medication. Swallowing may be impaired during stroke. If they're unconscious, check breathing and be prepared to perform CPR if needed. Position them comfortably, slightly propped up if conscious. Don't let them fall. Gather their medication list to provide to emergency responders. This information is crucial. Have someone meet the ambulance to guide them quickly if you're in a large building. During stroke recovery, emotional support is just as important as physical rehabilitation. Depression affects up to 1/3 of stroke survivors. Watch for signs and seek help. Anxiety is common after stroke. The fear of another stroke can be overwhelming. Cognitive changes may occur, including memory problems and difficulty with problem solving. Fatigue is extremely common after stroke. The brain needs extra energy to heal and adapt. Personality changes can happen, affecting relationships. Families need support and education too. Support groups connect survivors with others who understand their challenges and victories. Caregivers need support too. Caring for a stroke survivor is physically and emotionally demanding. Adaptive equipment makes daily life easier. Devices exist for dressing, eating, and mobility. Home modifications improve safety. Remove tripping hazards, add grab bars, improve lighting. Return to driving requires medical clearance. Vision, reaction time, and judgment must be assessed. Some survivors return to work with accommodations. Others transition to disability or retirement. Intimacy and relationships need attention after stroke. Communication and counseling help couples adjust. Financial concerns are real. Medical bills, lost income, and ongoing care costs add up quickly. Social workers can help navigate insurance, disability benefits, and community resources. Continued therapy at home reinforces gains made in formal rehabilitation settings. Technology offers new tools. Apps help with memory, communication, and tracking medications. Robotic devices and virtual reality are emerging rehabilitation tools showing promising results. Brain stimulation techniques may enhance recovery. Research continues on innovative treatments. Clinical trials test new stroke treatments. Ask your doctor if you might qualify. Stem cell therapy shows promise but remains experimental. Stay informed about research progress. The stroke community advocates for better awareness, faster treatment, and more research funding. World Stroke Day on October 29th raises global awareness. Join the movement. Community screening events offer free blood pressure checks and stroke education. Schools are teaching children the FAST test. Kids have saved parents' lives with this knowledge. Workplaces can promote stroke prevention through wellness programs and health screenings. Faith communities spread awareness and support survivors. Everyone has a role to play. Social media campaigns reach millions with stroke education. Share life-saving information. Celebrities who have survived strokes raise awareness by sharing their stories publicly. Legislative advocacy improves emergency stroke care systems and research funding. Stroke research continues advancing. Scientists work on neuroprotective drugs to save brain cells. Better imaging helps doctors see strokes faster and more accurately than ever before. Mobile stroke units bring CT scanners to patients, saving precious treatment time. Telemedicine connects rural areas to stroke specialists for immediate expert consultation. Artificial intelligence helps radiologists detect strokes on scans more quickly and accurately. The future of stroke care includes personalized medicine based on genetic risk factors. Prevention remains the most powerful tool we have against stroke. Your choices matter daily. Every healthy meal, every workout, every smoke-free day reduces your stroke risk. Managing chronic conditions protects your brain. Take medications as prescribed consistently. Regular medical checkups catch problems early when they're easiest to treat. Knowing your family history helps you and your doctor make informed prevention decisions. Teaching others about stroke signs multiplies your impact. Share this knowledge widely. Your brain is the most complex and precious organ in your body. Protect it fiercely. Stroke doesn't have to be a death sentence or a life sentence. Fast action changes outcomes. The FAST test is simple enough for children to learn. Teach it to everyone you love. Face drooping, arm weakness, speech difficulty means it's time to call 911. If you see any stroke sign, call 911 immediately even if symptoms seem mild. Don't wait to see if symptoms improve. Don't drive yourself. Call emergency services now. Brain tissue is dying while you hesitate. Minutes determine whether someone walks out healthy. The 3-hour window for clot-busting drugs closes fast. Don't waste time. The person having a stroke may deny symptoms or refuse help. Call 911 anyway. Your quick action could mean the difference between full recovery and permanent disability. Between independent living and needing constant care for the rest of their life. Between life and death, you have the power to save someone's brain today. Remember these stroke signs. Face, arms, speech, time, fast, don't forget. Make sure everyone in your household knows what to do in a stroke emergency. Program emergency numbers into your phone. Keep important medical information accessible. Know where the nearest stroke center is located. Not all hospitals specialize in stroke care. Comprehensive stroke centers offer the most advanced treatments. Distance isn't everything. Update your emergency contacts regularly. Make sure someone can speak for you if needed. Consider a medical alert system if you live alone and have stroke risk factors. Wear a medical alert bracelet if you have conditions that increase stroke risk. Keep a list of current medications in your wallet and on your refrigerator. Document any unusual symptoms even if they resolve quickly. Tell your doctor. Annual checkups should include stroke risk assessment. Request this specifically if needed. Blood pressure, cholesterol, and blood sugar tests provide crucial risk information. Don't ignore warning signs because you're busy, scared, or in denial. Embarrassment has killed people. If something's wrong, speak up and get help. You know your body better than anyone. Trust yourself when something feels seriously wrong. Medical professionals would rather you come in unnecessarily than arrive too late. The emergency room sees hundreds of false alarms. They won't judge you for being cautious. Time spent wondering if it's a stroke is time you can't get back. Stroke symptoms don't always fit the textbook description. When in doubt, call out. Better to feel foolish for overreacting than to live with permanent brain damage. Your loved ones would rather you call 911 than risk losing you forever. Think about the people who need you, who love you, who depend on you. You owe it to them and yourself to take stroke symptoms seriously. Every stroke survivor wishes they had acted faster or recognized signs sooner. No one ever regrets calling 911 too quickly for stroke symptoms. This knowledge empowers you. You now know what to look for and what to do. Share this video with everyone you care about. It could save their life someday. Subscribe for more health information that could save your life or someone you love. Leave a comment sharing how this information might help you or someone you know. Like this video if you learn something valuable about recognizing stroke symptoms. The life you save by recognizing stroke signs might be your own. Or it might be your parent, your spouse, your child, your friend. Stroke doesn't discriminate by age, race, gender, or health status. But knowledge does discriminate. Those who know what to look for survive better. You're now part of the solution. You can recognize a stroke and take action. Spread this knowledge everywhere. Make FAST a household acronym everyone knows. Practice the FAST test with your family. Make it a regular conversation. Check in on elderly relatives regularly. Notice changes in their health or behavior. Be the person who saves a life because you knew what to look for. Be the person who acts while others hesitate and wonder and wait. Stroke education is free. Stroke treatment is expensive. Prevention is priceless. Your brain is irreplaceable. Protect it through healthy choices and quick action during emergencies. These 15 minutes you spent watching could add years to someone's life. Quality years without disability, without dependence, without regret. Take stroke seriously but don't live in fear. Live informed and prepared. Control what you can control. Your lifestyle, your medical care, your knowledge. Accept what you can't control. Genetics, age, past choices. Focus on today's choices. Every healthy decision protects your future brain. Thank you for caring enough to learn this life-saving information. Now go share it, talk about stroke. Normalize these conversations. Make FAST as well known as CPR. Everyone should know these signs. You've been equipped with knowledge that saves lives. Use it wisely. Remember face, arms, speech, time, FAST, every second counts. If you see stroke signs in yourself or anyone else, call 911 immediately. Don't wait, don't wonder, don't worry about overreacting, just call. This is the end of the video, but hopefully just the beginning of you spreading awareness. Share, save, and remember this information. Your brain and your loved ones' brains depend on it.